use of frontline health workers without specialist training in dermatology. We believe that it will provide a method of recognition of these important diseases which would allow them to either treat patients there and then or to refer them onto specialist groups who could manage their treatment, and also to provide them a guide to the appropriate investigation.
Prevention of diseases can be achieved by shoe wearing, which could improve soil-transmitted helminths, tetanus, a variety of other NTDs. We also think it would be helpful in terms of advocacy, bringing a dermatological focus. There are several examples in some of the programs of skin NTDs who would work well in this regard, and also thinking of patient intervention packages and self-help packages which would improve skin care.
The skin NTDs includes several NTDs, which we traditionally group as IDM NTDs and the preventive chemotherapy NTDs. The integration can be seen in three aspects. One is the integration of various activities and interventions related to the skin NTDs across the various skin NTDs like Buruli ulcer, Yos, leprosy, Mycetoma, fungal skin NTDs, onchocerciasis, lymphedema, etc. The second is the integration among other communicable and non-communicable diseases. Some of the skin NTDs can lead to non-communicable diseases like rheumatic heart disease, and they have common manifestation like diabetic ulcers, and they have common managements with these other non-communicable diseases or even communicable diseases. The third aspect is the integration of various researches on skin NTDs, integrated researches that will help to enhance case detection, to enhance diagnosis, and to enhance also or improve the therapeutic arsenal against skin NTDs.
Very interesting video there. Hopefully you'll get to see it at the end of the session that we have today. So a very warm welcome to you, and thank you for joining us for the launch of the Strategic Framework for the Integrated Control and Management of Skin-Related Neglected Tropical Diseases, or SKIN NTDs. Now, during our discussion today, we'll be abundantly using the abbreviated term SKIN NTDs. Now, as we know, the skin is the largest organ of the human body. It is readily visible, and so any disease that affects the skin is clearly noticeable. The recognition that links numerous NTDs with the skin, which is their site of initial presentation, provides a potential route for delivery of the roadmap through a process of integration in diagnosis, control, and management. Now, mainstreaming NTDs within national health systems, as well as ensuring that interventions are fully integrated, are a priority of the NTD roadmap 2021 to 2030. And as such, the SKIN NTD framework is fully incorporated into the roadmap. So during today's much anticipated webinar, we'll formally launch the SKIN NTD framework and find out how it can be used by countries to achieve the roadmap's 2030 targets. Whether you're at the World Health Organization in Geneva or participating online via Zoom, what you will hear at today's launch will lead us toward or lead us forward in not only improving the prospects for those that suffer skin-related diseases, but also empowering national health services and public health workers in coordinating and supporting their work. I'm Patricia Amira, your moderator, and in order to ensure a smoothly run session, allow me to share a few pointers before we begin. For panelists joining via Zoom, kindly keep your camera on during your session and unmute only when it's your turn to speak. Online attendees can select the language of choice via the interpretation feature, which is located at the bottom of the Zoom page. Information on how to contribute to today's discussion is on your screen now, or should be, there we go. For this, kindly use Slido to post your questions, and I will endeavor to get through as many as possible during the time allocated. The hashtags to use on social media are skin NTDs and beat NTDs, tagging WHO as well, of course. And kindly note that as this event is being live streamed, your participation is understood as consent. Okay, by way of introduction, let's take a look at the big picture, understand the scope and the rationale for integrating skin NTDs within the wider roadmap. Joining us from the UK, where he is Professor for Cutaneous Infections at King's College London, and with vast experience brought to use in various institutions, and including the framework being launched today, is Roderick Hay. Welcome, Roderick. Roughly 1 billion people are affected. Sorry, there's somebody who has their terrible echo going on. Somebody needs to actually switch off there or mute themselves, please. Thank you. Sorry about that. Welcome, Roderick. Now, roughly 1 billion people are affected by skin diseases. That's a huge section of the global population. Correct me, it's 1 in 8 people suffer from such conditions. So why do you think these diseases have not received the attention that they need?
Thank you, Patricia. That's a difficult question to answer. I guess part of the reason is that although skin disease is very common, it is seldom fatal. And those designing health priorities often focus on diseases which carry the highest mortality rates. Having said that, this is more than just a huge number. People with skin disease have both physical and mental disabilities as a result of it. Severe itch, discomfort. As you said in your introduction, other people can see it. And so they're worried about it, they're ashamed about it, and it has a great impact on their quality of life. So having said that, the other thing that isn't recognized is that many of these skin diseases are very simply treated with inexpensive and relatively cheap and easily administered medications.
Thank you there, Roderick. I mean, you mentioned a few things, but you also mentioned the word common. Yes, there are obvious commonalities. So promoting skin health globally is essential, obviously, in reducing the suffering associated with skin diseases. But what are your thoughts on what should be done to promote this effectively?
Thank you. That's a very important question. I mean, essentially, I think there are 2 things that could be done. The first is to raise awareness of skin disease, that it may be common, but it's also important to people. One of the sanitary experiences I've had in my life is conducting a survey, and rather than taking what doctors felt was important to patients, actually asking them in rural populations. And interestingly, skin disease was one of their major priorities. Can you do something about this? So actually promoting the idea that not only can you treat skin disease, but that you can completely alleviate some of the symptoms is a very simple message. The second message, which I think is absolutely critical, is that we must ensure that there is adequate training. So not just information for populations and governments, but there is adequate training for healthcare workers at all levels in the community, because they're the people who have to see and treat skin disease. Yeah. And I think in that way, you not only improve the physical concomitants of skin disease, but you also create a happier and healthier population. So skin health is a major objective.
You're so right. It's about empowering of affected persons, their families, communities, as well as social systems. Many thanks, Roderick. Okay, what more in terms of support is needed to reach the global targets here? Jose Antonio Ruiz Postigo is a medical officer at the NTD department at WHO. Let's listen into what he has to say about expanding the area of skin NTD control and treatment, and how can we do more to build awareness and capacity, as Roderick has just said.
Back in 2018, WHO published a training guide for frontline health workers to recognize NTDs through changes on the skin. It is available both as a hard copy and in PDF in our website. It is available in English, French, Portuguese, and Spanish. 2 years later, in 2020, the content of the guide was updated and it was translated into a mobile app, also in the same 4 languages, available in Android and iOS, free of charge. And one of the most interesting features of the app is the fact that the diagnostic algorithm filters by country of origin of the patient. At the moment, we are working on a new version, version 3, which is a merge of the WHO Skin NTDs mobile app with the skin app of the Netherlands Leprosy Relief. Here are some screenshots of that pilot version, where you can see a body. You can select either the whole body or a specific part where the lesion is. Then you can click on one or more signs and symptoms. And then after the 3rd click, you get a list of potential conditions. It's important to note that the app is now including 20 common skin diseases and not only skin NTDs. As you know, artificial intelligence is now an emerging field, and WHO is working on the version 4 of the app with a team at Universal Doctor to incorporate artificial intelligence in this version. To do that, we need to create a network of experts so that we can build a global photograph database. In addition to the mobile app, WHO has a dedicated channel for online courses on NTDs, where we currently have 8 courses available on dermatology, skin NTDs, and general dermatology. As of last week, there were 15,000 learners enrolled, and we are having 5 courses in the pipeline that we hope to publish very soon on Buruli ulcer, cutaneous leishmaniasis, lymphatic filariasis, NOMA, and onchocerciasis. I would like to stress that all that is possible because the content is provided by a network of around 100 collaborators worldwide.
Self-paced online learning resources to support implementation that's available on the WHO website, as well as a free 21st century interactive tool that's soon going to be incorporated with AI to widen the scope in addressing global public health issues quicker and interactively. Good news, this certainly is. Now, following on from this last point, and with disease commonalities in mind, I'd like to invite Isra Cruz, who's the head of the International Health Department at the National School of Public Health at the Instituto de Salud Carlos III in Spain. Isra, welcome. Diagnostics have been identified as one of the critical needs for most NTDs in the roadmap. You also chair the WHO Skin NTDs subgroup of the WHO Diagnostic Technical Advisory Group, DTAG. What has your group achieved so far?
Hello, Patricia. It's a pleasure to be here and also talking on behalf of my colleagues at the DTAG subgroup on skin NTDs. They have done a very nice and very good job. So our group, the Skin NTDs subgroup, is addressing diagnostic gaps and priorities for a number of skin NTDs, and this includes Buruli ulcer, cutaneous leishmaniasis, leprosy, Mycetoma, scabies, and EOS. The group is composed by different people with different expertise in diagnostics as well as on skin NTDs, and so far we have been working on the definition of priority use cases and target product profiles, we call TPPs, for diagnostic tests needed to help addressing targets that have been set for these diseases in the new roadmap for NTDs. Several of these target product profiles are now finalized and publicly available for those interested in diagnostics development. And this includes TPPs for case detection at the point of care for Buruli ulcer, dermal leishmaniasis, and Mycetoma, as well as other TPPs for detecting for not just the pathogen, but for example, azithromycin resistant cases of Joyce, and also TPPs that should guide activities of mass drug administration for scabies. There are also other TPPs not yet publicly available, and this include some for different leprosy use cases, such as detection of infection and guiding the initiation of multi-drug therapy for leprosy.
Okay, and from what you've said, what can be done to increase access to existing diagnostic tests and technologies, Israel?
That's a very good question, and it's actually the challenge, right? So on one hand, and if we talk about integrated management of the skin NTDs, we believe it's important to identify opportunities for diagnostics integration, taking advantage of platforms and strategies that can be used across the diseases, the skin NTDs. This would include implementation of tools allowing detection of multiple pathogens. And in this sense, the skin NTDs subgroup of the DTAC, we will work to support other DTAC initiatives, not related to ours, such as, for example, the cross-cutting group focus on clinical diagnosis and image microscopy. I think it is quite clear now that both skin examination, but also microscopy is something that is useful and for skin NTDs diagnosis. But and this relates to what we already have, no? But what we know also is that the current tests, they are not adequate to address some of the targets in the roadmap. So it's a priority, one, or to improve them or to work on new ones, no? And this requires defining well the use cases and developing target product profiles for tests that will ensure that the priority use cases for different diseases are addressed. And perhaps this is maybe last but not the least, no, the country level advocacy on integrated approaches. No, we think this is very important based on co-endemicity of different skin NTDs. We believe it will be very important to sensitize and sustain political, programmatic, and cross-sectoral engagement to promote skin NTDs integrated activities, including, in our case, diagnosis. And therefore, advocacy at different levels will be needed, with in this case, with a focus on ongoing NTD program screening and diagnosis activities, which are the gaps, which have been the achievements, and how, and convince people on how the integrated approaches can accelerate the progress towards the roadmap targets. No?
Yeah. It's good to understand some of the complexities inherent in diagnostics, Isra. Thank you very much for that. Now, anticipating some questions from the panelists or for the panelists, a gentle reminder for participants who've joined us to submit them via Slido for the open floor session in just under 10 minutes. Turning to you, Ahmed Fahal. You are the founding director of the Mycetoma Research Center based at the University of Khartoum in Sudan, and are one of the world's experts on this disease, a disease that's proving extremely difficult to treat. So it's an excellent case to examine here. What do you see as the main challenges that need to be addressed to improve treatment for mycetoma?
Thank you very much for the kind introduction. Actually, mycetoma patients face a lot of challenges. First, there is no point of care test for mycetoma patients, and they have to travel a lot to major centers to have the diagnosis established and the disease and the treatment is initiated. Secondly, there is very few drugs available for treating mycetoma patients. For example, for the mycetoma, the fungal type, there's only one drug available for these patients.
Wow.
They have no access for this drug because the drug is very expensive, available in certain centers, expensive for the patient and for health authorities in mycetoma endemic areas. There is none on in the pipeline for mycetoma patients because most of the pharmaceutical company, they are not very happy to spend money on producing a new drug entity, which may be expensive, long time to take place, and a lot of people, they cannot afford to buy the treatment for these patients. The other important thing that is still the traditional medicine will be the only available treatment for this patient in certain endemic areas where mycetoma is prevailing. That this is very important to address the problem of mycetoma as one of the badly neglected tropical disease.
Now, I know there's an ongoing study. What progress is being made so far?
Yeah, regarding the study, it is a first ever double-blind clinical trial on a new drug for mycetoma patients, specifically for EU mycetoma, the fungal type. And we just finished the trial. And now we are at the stage of analyzing the data and to come up with some result from this clinical trial.
Yeah. And if the study is successful and taking access and equitability in consideration, obviously it's one of the things that you've mentioned, would the treatment be provided by the company for free, or what are the barriers yet to be broken here?
This is a very good question, actually. We are having a serious discussion with the company, trying to have a special price for mycetoma patients, either to get it free of charge or have a special price, because as I mentioned, these drugs are not available, expensive for the patient, the families, and the health system where mycetoma is endemic.
Okay. Thank you very much, Professor, for elucidating the importance of integration, of accessibility, and so many other points there. Now, in light of all that has been shared so far, now is a good time to talk more about the skin entity framework. And let me bring in Rie Yotsu, Associate Professor at Tulane School of Public Health and Tropical Medicine in New Orleans. Always good to welcome expert female input to the conversation. So, Rie, you have worked with WHO along with other experts to produce this document that we're launching today. So 2 questions to you. How would you summarize the importance of the framework, and how should we promote its wider use after today so that patients and programs benefit?
So thank you, Patricia, for this introduction. And I also am very happy to have this framework finally published, launched today. And I will summarize that this document is important as that it is the first document by WHO that it describes about skin NTD integration. And this is not only one skin disease, but multiple skin diseases discussed in one document. Finally, diseases that present with skin manifestations are getting attention and put onto the global agenda. I, as a dermatologist, I go to the field where skin NTDs are endemic and conduct surveys. And we find that the prevalence of skin diseases is very high, and there are also just as much impact on the population from any of these skin conditions. The framework is therefore designed to support each endemic country in establishing a strong healthcare system to deliver holistic services, not only for skin NTDs, but also for other skin diseases. Today, as we launch the framework, you can see that we have put as our ultimate goal to reach skin health for all.
Yes, skin health for all is definitely what we are all aspiring to hear. Thank you, Rie. And before we move on to address a few questions, let me remind you that today WHO is also launching its first guideline for the treatment of people who are co-infected with the human immunodeficiency virus, commonly called HIV and visceral leishmaniasis. I saw someone had put something on the chat that is a huge ray of hope. Now, the guideline makes region-specific treatment recommendations for patients co-infected with HIV and VIL in East Africa and Southeast Asia. The guideline is expected to improve access to treatment, enhance services for clinical care, improve coordination to address NTDs, HIV, tuberculosis, and vector-borne diseases, and proposes key monitoring indicators. And of course, you can access the complete guideline from the WHO website. I think the link's just been added on there by Ashok, as well as read today's press release for more information. Okay, let's now move on to a few questions for our panelists. I have one here for Roderick. What kind of interventions are being done for the mental health care of those suffering from NTD skin disease? Is there any specific framework for that?
I think the way of answering that is to say that actually it's all of our job as health professionals to improve the mental health of those with disease. Mm-hmm. One of the beauties of this scheme is that by placing neglected tropical diseases within a less threatening context of easily treatable and manageable skin disease, it actually reduces the level of anxiety in the population. And I think if you couple that with a good instruction in communities, many of the places where I've worked have run in parallel with clinical sessions, briefing sessions for people attending. And this provides a reassurance that they haven't got something awful and threatening, that actually they can get better.
Yeah, so right. And on the subject of frameworks, this question for you, Ree. How do you see framework activities interface with other skin activities, such as the detection of cancerous skin diseases?
Thank you for the question. So many of the skin diseases accompany with also various other other conditions, including HIV/AIDS and cancer, and this is not limited. And so not just skin NTDs, but many skin diseases lead a clinical course, which sometimes can be for a lifelong time and require long-term treatment and care. And so just coming back to the skin NTD framework, that in the framework we described how these patients with skin NTDs can get the care. But this is not just we are implying to the people with skin NTDs. We try to have the documents to put into in the broader spectrum of these skin diseases, including the cancerous skin conditions.
Okay.
However, the framework needs to be adapted into the context of the different countries and places within countries based on the epidemiology of skin diseases. And of course, some places also have the co-prevalence with the cancerous disease and HIV, tuberculosis. Tuberculosis also have skin conditions. And so these are all needs to be considered in putting the skin NTD framework forward. And also being the framework adapted into the country context will allow the country ownership and sustainability of what to be established through the skin NTD framework. Thank you.
Thank you very much, Ria. A question to you, Ahmed Fahal. For countries which suffer from conflict and have many displaced people and refugees, how can we increase awareness of the issues on skin NTDs, bearing in mind funding issues and competing priorities? Ahmed, are you still with us? He's still with us, but not on camera. Professor Fahal?
Yeah, sorry, I have some problem with internet. I did not
That's all right.
hear the question. Yeah.
Let me repeat that for you.
Yes, please.
for countries which suffer from conflict and have many displaced people and refugees, how can we increase awareness of the issues on skin NTDs, bearing in mind funding issues and competing priorities?
Yeah, our experience with mycetoma showing that most of the patients are coming from rural areas, remote from Khartoum and big center, so that we had 2 peripheral centers or satellite for mycetoma. We go there as a team, the team go there, and then we do a lot of advocacy, awareness, surgical intervention, ultrasound examination, mental health session activities. So it is now we go to the field where patients are there, and then we deal with the problem at the site.
Okay, thank you very much. Sorry,
This
go ahead.
Yeah, it is an expensive business. You need to have a lot of funding for the team to go there, to stay for 3-4 days, to offer them the free treatment and the free surgical intervention at that. So we're doing a lot of work with NGOs, with the local government there, with some of the donors. So from there, we managed to raise funds to support these activities. And we don't depend on the governmental support for these activities. Thank you.
Thank you very much for that. And thank you to all the panelists, of course. I just wanted to bring in another guest, actually, that we have, another speaker that we have with us, who is the Assistant Director General for the Universal Health Coverage, Communicable and Non-Communicable Diseases at WHO Headquarters, Dr. Renwin Huang. Ren, the integrated control and management of skin NTDs is critical to delivering on a number of United Nations health goals, isn't it?
Yes, absolutely. You're right. Thank you, Patricia. Nice to see you again on screen. So probably it's not too late to welcome you with our appreciation to this webinar launch of a skin NTD framework, which is a very important companion document to the NTD roadmap for the 2021-2030. The roadmap advocates integrated approaches to tackle NTDs, and these approaches are particularly relevant to the control and management of skin-related NTD, so-called skin NTDs. So skin diseases affect people of all age and genders in the developed and developing countries alike. While most of these conditions are easily treated, some are profoundly serious. Impoverished and marginalized population with limited access to diagnosis, treatment, and far from health facilities are among those worst affected, as some panel list just highlight. Building capacity in primary healthcare system to diagnose and treat this condition is vital to ensure that those affected has access to treatment. For some skin NTDs, such as Mycetoma, some people already mentioned, deep microchosis, and cutaneous leishmaniasis, accurate and effective diagnosis, test and treatments are lacking, and more research and development is needed. So gap that is common across many NTDs. So to address this gap, WHO has published and established diagnosis technical advice groups for the neurological diseases in WHO. And so digital health technology can also assist in diagnosis and provide remote specialist support for frontline health workers. We also need greater population awareness of skin disease and their seriousness. Therefore, the building the community health workers to detect and report skin problems to health workers is vital. These systems has been used successfully for trichomoniasis, leprosy, yawns, and other diseases. So today's webinar launched informs WHO's commitment to address skin NTDs through integrate cross-cutting approaches and to serve the communities that need treatment. By working with other diseases, public health programs, and by integrating our efforts, we can support our member states in promoting skin health for all, as our professor said, skin health for all as a part of a universal health coverage. So we are looking forward to discussion today with partners and Minister of Health colleagues, and who are the front lines and the implementation on how to operationalize the skin NTD framework into national policies and service delivery systems. So I thank our panelists and partners joining us in person or online today, and looking forward to this fruitful discussion. Thank you, Patricia.
It's great that you could join us and share your thoughts with us today, Ren. Thank you once again. And thank you, of course, to all the panelists and the participants for your invaluable contributions during the first session. We'll have to stop there and take a quick break before we get to hear about some in-country experiences from our next set of experts. Wow, I was just looking at that and thinking the mental and psychological impact, apart from the physical, of course, must be immense for a lot of these persons suffering from skin diseases. So thank you for, or to DNDi for sending that in. We'll be continuing the conversation by getting behind some of the on-the-ground context, or getting behind some of on-the-ground context whilst highlighting a number of skin-related diseases. To begin, I'd like to invite the Assistant Minister for Preventive Services at the Ministry of Health in Liberia, the Honourable Joyce Sherman. We thank you for joining us today, despite your busy schedule. Your country, Liberia, has been one of the pioneers of integrated approach of skin NTDs in West Africa, if not Africa in total, but focusing on Buruli ulcer, leprosy, lymphoedema, management of lymphatic filariasis, and yours, of course. Share with us just how Liberia has managed to move in this direction of integration, please.
Good afternoon. Thanks for having me on. This is Sherman from Liberia. I'm at the WHO office in Liberia, and I'm glad to be here to share some experiences. And I would briefly just say how. The first one is, how did Liberia manage to move this direction to integration?
Yes.
You know, Liberia has been, skin diseases and integration has been foreign to us because we have a number of donors, scarce resources, and recommendation from WHO with funding agencies. We have managed to integrate. Integration is not very easy when you don't have resources coming from government, but integration eventually is very, very fruitful, and it rewards the program by destigmatizing, making services available, and sharing resources. So briefly, this is how we have, it was not easy, but we have managed to progress. But we only have done that in 5 regions in the country when we have 15 regions. And we are lobbying for funds because it is working out, and we're getting a lot of gain from our experiences. And I will stop at that for our experience.
And in terms of sustainability, how can we best maintain it and grow it to the 15 regions, as you mentioned, but sustainability is key here?
Sustainability is key, and my experience has taught me again, sustaining with not very much coming from government, but with the launching today and, and sensitizing and making it known, it's been hidden because it was stigmatized, it was not prioritized. It will be sustained because of the movement to integration. And again, when you get a program and you have the population integrated, we'll have to just share resources and maximize what we have, and that's how we will sustain. But again, we need to expand it to other regions. These are actually pilots. And because there is funding from an agency or a partner, that was included, but we still have a long way to go. But we are going to go into sustainability if we integrate more.
Yes, it is key. So what specific lessons can you share with other countries at this stage?
Specific lessons with other countries, and integration is more cost effective. Some of us will argue with that because it's easier to run vertical programs. But in a long run, when you have no funding, you leave a gap or you leave you run out of services. But when you integrate, which takes longer, and bargaining and sharing resources, you have a far-reaching effect. And effective way to manage human resources. You can do now, you see with the training package today, you can train people to be multitask. You can sensitize people that it can be done. 3 is an effective way to manage logistical distribution. For example, we do MDA. We join with the expanded program of immunization when they're having campaigns like now. This is the time for measles, mumps, and rubella. We are having campaigns. We join with them to do MDA for deworming and skin diseases. Over.
Thank you very much for that. I think, your words certainly resonate with, people who are in lower and middle income countries with limited health budgets. And of course, that mention about cross-cutting there again, it's so important. Thank you so much, Honourable Minister. And turning to Ghana, a country that has been piloting the integrated approach to skin NTDs for a couple of years now with the support of some partners. Speaking to this is Benedict Quarshie, a program manager with the National Leprosy Elimination Program at the Ghana Health Service. Benedict, as program manager of leprosy elimination in Ghana, point by point, how has this integration helped so far?
Thank you for the opportunity. We have seen with the coming together of several NTD programs working in the same space that we have increased the efficiency regarding the use of resources, time, not just money. We have been able to reach areas where individual programs could not reach before.
Yeah.
Even with some of the interventions like the active case searches, we have unearthed skin NTD conditions in areas that were hitherto not known to have those diseases and were endemic for another disease. So that's with coming together with other NTDs. But then we also have used the regular health system structures, which has led to increased ownership by the various levels, which then maximizes opportunities for integration because there are a lot of things always going and those resources can be channeled to help skin NTDs. We also have increased visibility within the health system because now all peripheral healthcare workers are joining and suspecting cases. And through this project, we have been able to introduce certain tools to get data and surveillance data. We're on the DIMS tool, which is a national system for health information management system. And that has a strong sustainability benefit to that. And then we have been able to improve linkage to laboratory confirmation, even to the extent that the public health reference lab is looking to build capacity to support the diagnosis.
Okay, and what have been the two, top challenges that you faced in implementing this integrated approach?
Okay, now to do this, you need a lot of training, and we've trained a lot of staff, and also volunteers within the community. But we have realized that for obvious reasons, you can't force people to stay in one place. You have a high attrition. People need to go to school. People need to move because of family reasons. For some of the CBSVs, they want to move into small scale mining where there's a lot of money. So it means that you have to constantly go back in there and train, and that is also a challenge. Now, what we had at one point was the changes in managers at various levels, bringing some disruptions in what we were doing, because there's a pilot. The rest of the country is not part of the pilot. Yes, we are trying to make those districts imbibe some of the methods, but once you have a new person coming in, it disrupted what we're doing. Yeah. But then we have been able to go over that with some of the documentations we've included now, the DIMS 2 that we now have the forms on. So right now we're in a stronger place. Also, this integrated approach brought in a level of ownership by the regional level. They have a steering committee now for skin NTDs, which then helps to ensure that any new incoming manager at the district level is brought is updated on whatever we're doing regarding the skin NTD approach.
Okay, so capacity building it is. Now, and the overall aim of the NTD roadmap, of course, is to empower member states. So what is the government of Ghana doing to sustain the efforts should, partners up and leave?
Yes, so the Ministry of Health, the Ghana Health Service, has always worked to progressively be sustainable on our own, to be able to carry out the public health interventions with domestically available resources. Now, we shouldn't take away one big asset we have. We have an existing workforce which has a basic public health skill set, which can be channeled into skin NTD once the various levels own whatever we're doing with the skin NTD approach. And to mind that, we're now looking at pushing the skin NTD topics into their pre-service curricula, and even it is part of the new comprehensive HR training needs that has been done within the service. So now we get the UHC working for skin NTDs, and I think that is really the way to go. We also have the intra-country coordinating committee for NTDs, and it brings together other public sectors. So now we are able to get resources from local government, education, to be able to sanitation and water resources, to be able to carry out some of our activities. Of course, I've mentioned all the various advantages for integration, and those things build sustainability into whatever we are doing. So if the partners do leave, and I know partners always love the people, so we'll not leave, we'll still be able to continue. Thank you.
Thank you, Benedict. Now, having heard from Liberia and Ghana, let's pivot and listen in to hear about progress in the South Pacific Islands of Vanuatu. Prudence Rymel, the National Coordinator in the Ministry of Health, will explain.
My name is Prudence Rymel. I'm the NTD National Coordinator working under the Ministry of Health of Vanuatu. For Vanuatu, I'll be sharing the experience from our Voice in Action from this field activity, which is integrated NTD MTA administration and survey in Tavia province. So in November to December 2021, Vanuatu NTD program conducted an integrated MTA campaign with NTD survey in Tavia province. So this is the first ever integrated MTA campaigns where we combine the treatment of azithromycin, albendazole, and ivermectin together. And for survey, NTD survey, we collect samples for all the 7 diseases of NTD, such as we collect dry blood spots, collect stool samples, and swab samples as well. So a total of 17 health teams were mobilized in Tavia Province for 2 weeks to facilitate community in skin screening, provide mass treatment, and collect samples for further lab testing. So the outcomes of this campaign was a total of 26,895 people were registered and screened for skin diseases. 24,104 people were treated with ivermectin, 301 people were treated with benzoate lotion, 23,139 people were treated with albendazole, and we have 4,489 people were treated with azithromycin. So the main challenges during this mass campaign and this survey, where we have limited the number of health workers to support this mass campaign due to global pandemic. Also during the operation, we clash with the COVID-19 vaccination, which causes confusion within the community with MDA campaigns impacting MDA treatment coverage. We have lengthy financial process plus an uncertainty pandemic situation causing very challenging in releasing funding to the provincial level for the operation to implement timely. And lastly, we have delay of procurement processes and reduction of shipment and border lockdown causing delay in receiving drug supplies in times of this mass campaign.
Prudence, thank you. So significant progress in yaws eradication happening in Vanuatu, bringing the total number of cases very low. Plus, of course, good to hear about the integration with other diseases is also underway. Thank you, Prudence. Now over to Southeast Asia, to Timor-Leste, which has almost eliminated yaws. I say almost, as there has been no positive cases for a few years now. Josefina Clarinha Huang, the National Director for Disease Control in the Ministry of Health, will talk us through their experience.
Hello, my name is Dr. Josefina, and I'm working as the National Director for Disease Control at the Ministry of Health in Timor-Leste. I'm glad to share our experience of the Transmission Assessment Survey in Timor-Leste. It is a platform to understand the epidemiologic profile of multiple endemic neglected tropical diseases known as NTDs. This includes lymphatic filariasis, soil-transmitted helminthiasis, scabies, and also yaws. It was also an opportunity to raise public awareness of NTDs in school and communities around the country. During the survey, field team from the World Health Organization and the Ministry of Health visited 234 primary schools across the country, delivering health messages including on water, sanitation, and hygiene to students and teachers. Trained medical professionals from community health center screened over 12,000 students from skin infections. Among them, 64 scabies cases were clinically detected and treated. Rapid diagnostic tests using SD Bioline or combo card tests were also conducted for more than 200 students with yaws like skin lesions to confirm zero positivity. The project was conducted in the middle of the pandemic. Therefore, we faced many challenges during the planning and implementation process. One of the main challenges was ensuring standard service quality of field workers. I'm glad to say that Timor-Leste is nearing the eradication of lymphatic filariasis. We are better managing soil-transmitted helminthiasis, and our country is also close to ending yaws, but we still have to work to do, and we look forward to delivering better health outcomes and eliminating NTDs as a public health threat. Thank you so much for your attention, and congratulations on the launch of the Skin NTD framework.
I think teach them early seems most appropriate there. Thank you very much, Josefina. Joining us now from Pakistan is Christian Schmotzer, director of the Rawalpindi Leprosy Hospital there, that is also implementing integrating activities. Welcome, Christine. Which diseases have you integrated and how is this integrated approach working out? We need you to unmute there, Christine. We can't hear you. There you are. I can hear you now.
Sure. Referral hospital for leprosy for the northern half of Pakistan. And the hospital already almost 40 years ago started an integrated approach with general dermatology and general physical rehabilitation. And then the hospital further integrated with a tuberculosis control program, and then since 5 years with cutaneous leishmaniasis. And we feel that there are very strong synergies, so to say. The integration is helping for better management of all diseases. Rawalpindi Leprosy Hospital has first developed a diagnostic flowchart and standard operating procedures for management, supporting an integrated approach to the target diseases. And also there are strong referral links to primary healthcare facilities. The main achievements which we have seen are reduced leprosy-related disabilities due to strengthened early case finding. We also have seen an improved management of cutaneous leishmaniasis and generally a very much reduced stigma to the target diseases in the working areas.
Okay.
What we feel as main challenges is the limited awareness about skin NTDs in the general healthcare workers. On this challenge we are working right now, and also the limited availability of good quality antimonial drugs for cutaneous leishmaniasis.
Thank you very much for that, Christine. I mean, you really went into the challenges there. I was about to ask exactly the same thing. Thank you for addressing that. Silvana Penini, you're the director of the Amazon Foundation for Tropical Dermatology and Venereology. In reality, you work in one of the most challenging Amazonian regions of Brazil. Welcome to you. Firstly, which are the skin NTDs that are prevalent in this region?
Hello, everybody. It's a pleasure to be here and talk about our reality in the Brazilian Amazon. And the most prevalent skin disease, NTDs, are scabies, leprosy, cutaneous leishmaniasis, and fungal disease.
So what is the team doing to help the populations affected by these skin diseases?
I will continue speaking in Portuguese to be more comfortable.
Go ahead, please.
A nossa principal dificuldade no Amazonas, na Amazônia brasileira, é o meio de transporte da população e o acesso à saúde, aos serviços de saúde. Eles ficam muito isolados, às vezes, os rios são muitos na região, é o principal meio de transporte, a minha principal via de transporte são os rios, e dessa forma Estou mostrando aí um pouquinho, tá? Está aparecendo? Então, dessa forma, eles têm uma dificuldade. Os municípios são precários, né, de estrutura, de saúde. E o que a gente tem feito é buscado levar equipes multidisciplinares a essa população mais carente. E nós temos tido algum êxito com isso. Eu mostro aqui que os aviões são meio de transporte para os municípios mais distantes, mas isso acaba ficando oneroso para a população. E as estradas são poucas e são mais próximas a Manaus, aos municípios de Manaus. Então, outra dificuldade é a vazante dos rios, né, as secas, que tornam maiores as distâncias, e também a dificuldade que a gente enfrenta é a baixa densidade populacional, tá? E também tem a questão da saúde indígena. A saúde indígena, nós vemos que tem características próprias, né? A gente precisa de autorização para chegar até eles. Tem a questão cultural de se aceitar o exame dermatológico e o tratamento, e tem também a questão da língua. Cada etnia tem a sua própria língua. Então, mesmo com essas dificuldades, nós temos conseguido levar essas equipes junto a essa população mais carente, como eu falei, e feito alguns atendimento multidisciplinar, né, com exame dermatológico, com visita domiciliar, com tratamento, né, levando medicamentos, principalmente, e com isso a gente tem conseguido diagnosticar e tratar bastante essas doenças. Para os municípios que têm mais condições, a gente está conseguindo fazer treinamento, capacitação em loco, às vezes por plataforma virtual, né, que facilita muito a demonstração da microscopia, por exemplo, e também conseguimos fazer um treinamento à distância via web, consultoria também. Então, esse é o nosso maior desafio e as nossos maiores ganhos com os esforços que temos feitos, né? E, apesar dessas dificuldades também, eu acrescentaria alguma coisa que tem sido feito dentro da própria fundação, a qual eu represento aqui, que é a Fundação Tropical, né, de Dermatologia Tropical Alfredo da Mata, e que é oferecer campo de estágio para vários cursos de saúde e oferecer assistência, né, assistência médica, com dermatologistas, oftalmologistas, ortopedistas, oferecer cirurgias para essas doenças, incluindo neurólise, fisioterapia, confecção de órteses, pesquisa de resistência ao hemilepre, aos medicamentos. E, de forma indireta, nós temos contribuído com a formação dos profissionais, né, também oferecendo residência médica em dermatologia e mestrado em ciências dermatológicas. Com isso, acho que a gente consegue melhorar a assistência dessa população.
Thank you very much there. Excellent in-country insights, and so many questions have come in, but I'm going to have to select here. Let's start with you, Benedict. How do you work with community leaders, traditional medicine practitioners, and administrative authorities in your integrated approach, as I think Professor Fahal had indicated or talked about this earlier?
So we have a well-established district health system, which even works with the district health committee, which has members from various sectors like religious leaders, you have opinion
Yeah.
leaders, and so we have a system there that we have sort of piggybacked. We have worked with that, and at every level, before any implementation of an activity, there's engagement of the various stakeholders. If there are local NGOs, the districts also have them listed. And so they bring them on board in anything we are going to do at that level. There's really, you should enter the district space and you realize that there's a lot that goes on that comes under the district director. And by using those structures, we are then able to get the full advantage of that integration. So we are using them. Sometimes even they end up referring cases to us.
Oh, that's good.
We've had cases of that. So
yeah.
Yes.
Thank you, Benedict. Question for you, Silvana. Given that water and sanitation are important to prevent many skin diseases, what are the biggest challenges to integrate these aspects with the medical interventions?
Entendi. Sorry, could you repeat, please?
Sure. Given that water and sanitation are important to prevent many skin diseases, what are the biggest challenges to integrate these aspects with the medical interventions?
Os cuidados, se eu entendi bem, os cuidados com a água e com a sanitarização, né? Isso é um grande problema também na região. Nós temos tentado combater isso conversando com as autoridades, né? E tentando melhorar a estrutura desses municípios. Nós temos feito muita educação em saúde, tentando levar à população essa informação do quanto é importante essa questão, né? E levado alternativas para eles de forma mais caseira, que eles possam tratar de sua água e cuidar dos seus dejetos. Através, basicamente, da educação em saúde.
Thank you very much, Silvana, for that. Let's see. There's a question here that I'm trying to understand. For you, Benedict, were you about interest or engage? Were you able to get interest or to engage external funders when planning to expand? No, this question is not for you, Benedict, because it says here Liberia. This is actually for Sherman.
Okay.
So when the question comes in clearer, I'll be able to ask it. Okay, can any one of the speakers who are with us, or the panelists, elaborate more on integration in terms of human resources and financing? Perhaps we could have Christine or Sherman. Of course, Silvana or Benedict can respond as well.
Maybe I can give a short reply from our side.
Please, yes.
We have the very good situation that we have a strong working relationship with the provincial government health department, but we are also supported by the German Leprosy and Tuberculosis Relief Association.
Okay.
And this cooperation is going on for many years, and that has shown, in my opinion, very good results, and this is very beneficial.
Thank you very much there, Christine. Another very brief comment before we wrap this also brief Q&A. Benedict, would you like to add something there?
Well, okay. Since as you mentioned my name.
I'll put you on the spot.
Yeah. Again, I always go back to the structure of the health system and how it makes available to us the mix of health professionals at any level to be able to carry out our activities. So once you make it a health system agenda, the health system works to be able to achieve that in terms of human resource and in terms of finance, because at every level, there's also the internally generated funds. I mean, little things like moving out and everything. If your agenda is on the district or regional table, you're more likely to get resources to support. You know, you're more likely to be able to piggyback other programs that are going out. You know, you lump up activities together, and then you're able to carry them out rather than wait to get separate funding to go and do that. So it's all about trying not just to come together as skin NTD entities, like working together, but to use the regular structures. We have seen a lot of benefit for us in Ghana.
Okay, thank you. These are compelling short stories from our panel of experts that speak to the crucial need for integrating control and management of skin diseases within the wider framework of NTDs. Solid observations as well from the floor. I'm so sorry we couldn't get through as many questions as we wanted. Of course, any that have not been responded to have been noted by the rapporteurs and will later be shared on the WHO NTD website at a later date with the information that is needed. During the short break we have coming up, we'll get to have a quick view or quick reminder of what the NTD roadmap sets out to do.
It's beautiful.
The Skin NTD framework emphasizes a people-centered integrated approach to enable countries to tackle the morbidity, the disability and psychosocial impact of skin NTDs and other conditions. Now that we've learned more about the resources available, identified some focal areas for improvement, as well as examples of adaptable approaches, let's look into the types of partnerships that are needed to really elevate the ongoing efforts in this third session. And for this, we have Inigo Lassa, who's the Director General of ANESVAD Foundation, Jeff Warren, who's the CEO of the International Federation of Anti-Leprosy Associations, Alphonse Mbok, who is the Senior Technical Advisor for FairMed in Cameroon, Michelle Murdoch, the Chair for the NNN Skin NTDs Cross-Cutting Group, and is also a consultant dermatologist in the West Herts Teaching Hospitals in the UK. Aparna Srikantam, the Chair of the NNN DMDI Cross-Cutting Group and Research Head of the Leprosy Relief Association in India. And of course, David Denning, who's the Chief Executive of the Global Action for Fungal Infections. I think I've got everybody there. Okay, thank you for taking time to bring your considered contributions to the discussion today. Inigo, I'll start with you. You head the ANESVAD Foundation that has been supporting the integrated approach in a number of countries, namely Benin, Cote d'Ivoire, Ghana, and Togo. Targeted diseases include Buruli ulcer and leprosy and yours. What are some of the lessons learned in implementing this approach in West Africa?
Well, hello everybody from Spain, and thank you to the WHO team for organizing this important event. And SWAT has been working in Africa for almost 8 years, focusing for the last 7 years all of our work in combating skin NTDs. And for the last 5 years, we have gradually started to implement in 4 different Western African countries the logic of the integrated approach with formal agreements with Ministry of Health. So related to the lesson learned, I will mention a couple of them. The main one probably would be that the integrated skin NTD approach should consider people not only as suffering from a particular disease and requiring skin NTD attention, but as members of a community with other overlapping health-related needs and context-related factors that shape access to health. For this reason, NFAC believes that the integrated skin NTD approach must be conceptualized within the logic of the right to health. Another important lesson learned has to do with our observation about the high number of dermatological ailments detected as opposed to skin NTDs. And I don't know if you can share the first slides that I sent you. Yeah, that's it. So, well, you can see these are the overall data from active case diagnosis sessions carried out in Benin from April 2017 to September 2019. So as you can see, not only a significant variety of skin NTDs are identified, but a large number of the dermatological problems, no? Which without this integrated diagnostic method would probably not have been identified. So they account for the vast majority of the disease identified, as you can see. And we can conclude that the integrated approach has led us to a dermatological rationale that goes beyond skin NTD. No? You can show the next slide. So another lesson important for us is creating a tool to monitor and evaluating the integrated approach. I mean, it helps us a lot to understand where to concentrate our efforts and what are the challenges of these skin NTDs at the field level. So as you can see in the slide for the evaluation of our programs with the government, we developed this tool divided in different criteria and levels, even different sorts of intervention. No?
All right.
And the last, yeah.
Sorry, it's just because of time.
Yeah,
so,
sure.
Yes, I really love you to just list them so that we can, and hopefully you can share your slides as well at the end of the session. That would be great.
Okay, sure.
Sorry, so mention the last one. Go ahead.
Yeah. Okay. So I would say that it's possible to work with several also national NTD programs. You know that every country has or one skin NTD program or several ones for each disease. No, so we think that it's possible to work in wherever way, but its coordination, of course, is much more complicated. No, so it would be more ideal to have programs integrated for more efficiency. But at the field level, it's true that you feel less these difficulties. It's more in the coordination at the national level.
Yeah, and I'm sure you know this, government commitment and country ownership they're critical to the success of any program. How has your foundation worked with governments in these countries?
Yeah, well, facilitating government commitment is always much easier if we work in coalition with various organizations. No? Like we have a very good example lately in Ivory Coast, where recently a group of organizations managed to encourage the government, actually the Prime Minister itself, to invest in the skin NTDs. No? But in general, we put a lot of hard work in government commitment, but it's a bit by bit process, which it's sometimes is vulnerable to external elements. Like, for example, it would be undermined by a change of government. No.
Yeah.
And now we are in the midst of changing methodology from focusing on implementing activities to more a result-based financing methodology.
Yeah, good. And how do you see sustainability in these countries in case your foundation leaves one day?
Very, very relevant question. If we talk about financial sustainability, it's really very difficult to reach. For example, we are talking about countries that invest in skin NTDs like 100,000 euros per year when millions are needed. No, And it is especially complex in African countries with multiple needs for financial resources, where in addition, NTDs are not a priority, and particularly skin NTDs. No, so I think that the integrated skin NTD approach also helps the sustainability, because resources are poor and various issues can be detected and treated at the same time. But to work towards sustainability, the responsibility of Foundation ICANN, I think, is to carry out pilot actions and generate evidences, so this can be scaled up by government. For this purpose, it's really important to show the government the economic as well as the social cost of not attending these illnesses.
Thank you very much for that, Jeff. I'm going to turn to you. ILEP's vision is for a world with zero leprosy. Unfortunately, we still see hundreds of thousands of new leprosy cases for over a decade now. How can integration with other skin NTDs help countries to achieve zero leprosy?
Thanks, Patricia. Yes, our vision is a world free from leprosy, and that's not just zero leprosy transmission. That's also zero disability, zero stigma, zero discrimination. Most ILEP member associations came into existence decades ago, in fact, some more than a century ago, specifically because of leprosy. And that's led quite naturally to programs that were solely focused on leprosy. But in recent decades, we more and more embrace the benefits of integration. It seems to me that an integrated approach is effective where there are commonalities between diseases and where there's recognizable advantages for each disease. So countries planning integrated approaches need to do it in a thoughtful way that doesn't just lump diseases together, but analyzes what the gains are going to be and how the downsides or risks, and we do need to be frank that there are some downsides and risks to integration, how those can be reduced or avoided. Four of the ways that integration can help towards zero leprosy seem especially promising. First, joint programs for active case detection and for contact tracing. Second, detailed integrated mapping using some of the advanced mapping tools available. And I mentioned particularly in that regard the work of ILEP member American Leprosy Missions. Third, that whole group of essential services around the management of disease complications and disability prevention and social inclusion. For example, we've known for centuries about stigma in leprosy, but it's been a revelation in recent years to see how big an issue this is in some other skin entities as well. And finally, and perhaps most important, an integrated approach to training and to building the capacity of health workers at all levels.
Okay, now sometimes we hear concerns about loss of expertise in leprosy as one of the challenges of integration. But like most diseases, expertise is also lost through retirement. So catch the early ones or catch them early, as the saying goes, as I said earlier. But how can this issue be addressed to achieve zero leprosy?
Yeah, well, Patricia, you'll see that my hair is starting to go grey as well. And it's been a privilege to know leprologists and other specialists during my career who've devoted a lifetime to leprosy. And yes, like all of us, they grow older, and there are fewer early career people embracing leprosy like those guys did, but male and female did. But this is a problem not just at specialist level, but at all levels in their health workforce. Every leprosy patient and every skin NTD patient has the right to a correct diagnosis and to prompt treatment. So health workers at all levels need the skill and experience to do that. And a whole lot of separate single disease training initiatives isn't going to produce that result. ILEP had a major online conference in 2020 looking at how we were going to reverse the erosion of leprosy expertise. Now, it's obvious that some aspects of leprosy know-how, like nerve function assessment and the management of leprosy reactions, it's obvious that those need specific training, and we need to have mechanisms for that. We certainly don't want integration to result in the erosion of leprosy know-how and skills. But from the zero leprosy perspective, we found ourselves keeping on coming back to the position that leprosy capacity building ought normally to be integrated into skin disease training. It's not usually financially viable to provide specifically leprosy training across the whole health service. So you look for opportunities to include leprosy in multi-disease training. And integrated skin NTD training programs will include leprosy training for health workers who wouldn't normally attend a specific leprosy course, even if there was one. In fact, attending courses on skin NTDs will be the first time that sometimes the trainees hear about leprosy. And that's great for zero leprosy.
Yeah, thank you very much, Joff. So let's move to you, Alphonse, the yaws eradication effort in Cameroon, Central African Republic, and the Republic of Congo being led by you and your team. Who are the partners involved in this project, and what has been the progress so far?
Yes, thank you very much, and thank you for giving this opportunity to us to share with you what we are doing. Concerning, coming back to your question, the major partners in this project are first OSEAC, which is Organization for Coordination and Cooperation for the fight against major endemic diseases in Central Africa. They are responsible for the general coordination of this project in the sub-region. The second one is KFW, which provides the funding for this project, and the National NTDs Control Program in the Ministry of Health in the implementing countries, who are the actual owner of the project. And of course, we have FERMED, who is providing the technical and financial coordination. And I have also to precise that FERMED is working in many other countries. Now, in this project, we also have a WHO who is supporting the project through the provision of azithromycin in collaboration with EMS, a Brazilian pharmaceutical firm, as well as laboratory tools like PCR for yaws and Buruli ulcer. In addition, WHO provides also strategic guidelines to countries in planning and implementing and follow-up of yaws eradication and surveillance activities. We also have as partners EMS, as I said previously. They are providing azithromycin for the mass drug administration. We also have the National Reference Laboratory, namely Centre Pasteur of Yaoundé, Institut Pasteur of Bangui in Central African Republic, and the National Lab in Congo. Now, concerning your second question, your second question about
the progress.
The progress, yes.
Which you've already mentioned. You mentioned quite a bit there, but yes, is there something more you wanted to add there?
Yeah, then concerning the progress, what I can say is that we have been able to first to build capacity of health personnel, community health workers, about 5,000 health and community workers have been trained in these 3 countries in 37 target health districts. We also have the National Lab also of Congo and Institut Pasteur of Bangui have been strengthened to be able now to diagnose Buruli ulcer, putting in place also a robust surveillance system to carry out integrated surveillance of skin NTDs. And the leprosy situation was also revived in those 3 countries. And also more than 1 million persons were treated with azithromycin during the first MDA campaign that took place in the 3 countries. This MDA was the first large scale since the establishment of the MOSH strategy of yaws eradication in 2012. And also,
Alphonse, there's some great work going on there. My question here is there a sustainability plan in place?
Yes, about the sustainability, what I can say is that our sustainability approach was based first on the integration of several diseases, not only just one disease, that is single disease. This project also is implemented by the National Leprosy Yaws Buruli Ulcer Control Program in the Ministry of Health. And also, I can also mention the domestication of the expertise, because in each country, we have set up team trainers in, in all districts. Then the expertise is also there. But however, the needs are huge. If the same country must meet the target for youth eradication by 2030, more resources will be needed to consolidate the current activities and to scale up all endemic health districts.
I'm going to have to stop you there, Alphonse, so that perhaps we can take some questions as well at the end of this session. Michelle, turning to you, you're the chair of the NNN Skin NTDs Cross-Cutting Group. Briefly, what does this group represent?
Thank you. It is an honor to tell you about the Neglected Tropical Disease NGO Network Skin NTD Cross-Cutting Group. We're a relatively new mixed group of WHO and NGO representatives, dermatologists, public health physicians, epidemiologists, and researchers. Our aim is to facilitate the paradigm shift away from managing single disease entities towards integrated control of skin NTDs. We started off as a small, rather eclectic group back in March 2019. And our first workshop was held in September later that same year, when everyone openly shared their experiences of working in the field. And the main learning point from that workshop was that skin NTDs are best treated within a wider framework of general skin diseases. This seems such a simple point, but it has guided our thinking since. And of course, it also helps to reduce stigma and discrimination associated with skin NTDs. Unfortunately, the COVID-19 pandemic then followed, but the upside of this was that our meetings went online and enabled an increased number of participants from all over the globe to attend virtually. I now have my slide. So what has this networking group been and who has been part of it so far? Starting from the top left, clockwise.
If I could just jump in and just add something as you go about this, how can this group contribute to WHO's efforts to implement the framework? So yes, go ahead.
I'll outline what comprises the group, and then I'll give you some examples. So starting at the top left, WHO's Department of Control of Neglected Tropical Diseases is our engine room, coordinating everything and including the important current and hopefully future interactions with ministries of health. Next, our own skin group sits within the wider Neglected Tropical Disease NGO network, which includes more than 80 NGOs worldwide. The International League of Dermatological Societies has more than 180 member organizations and has had official relations with the WHO for some time, such as developing the WHO list of essential medicines for dermatology. The International Foundation for Dermatology carries out the humanitarian work of the ILDS and its main interface with our skin group. And finally, we interact with researchers from various institutions. In summary, the Skin NTDs Cross-Cutting Group is totally committed to supporting the development and implementation of this strategic framework. And you asked me for some examples of how this group can implement the framework. I'll give you some examples of the activities we've already been doing, and then we'll look ahead to the future. Firstly, with WHO, as you've already heard, two of our members, Dr. Yotzi and Dr. Ravanka, worked with WHO to develop the framework, and the skin group were later invited to give feedback on the draft version. Secondly, you've also heard from Dr. Postigo about the Skin app and the online WHO online courses, and many of our members contributed to producing these training tools. In addition to the production of training materials, we are exploring evaluation of training with research personnel. That's both assessment of the trainee and of the training program itself. For example, assessing the impact of a training program on healthcare. And my final example is looking ahead to the future. Our link with the International Foundation for Dermatology, which has, of course, the Regional Dermatology Training Center in Moshi, Tanzania, the Community Dermatology Training Program in Mexico, and also a relatively new group called GlowDerm, which mentors dermatology trainees. All these will help towards developing programs of training the trainers for frontline health workers, which will create the workforce for implementing the strategic framework. Thank you.
Thank you very much there, Michelle. Aparna, turning to you. Skin NTDs impose significant common burden. We know this, disability, stigma, mental health, which require an integrated approach to management irrespective of their different etiologies. What are the benefits of integrating these management approaches? And of course, if you could mention one or two challenges there as well.
Thank you, Patricia. Hi, everyone. Yes. We have to understand what is integration before going into its rationale and benefits. So in the context of the Skin NTD framework, we consider integration as grouping and packaging of several diseases depending on their burden in countries to facilitate joint delivery of interventions through a common platform. So what makes is very important, the integration for NTDs is they are really having some very common burdens, which are very significant for countries and programs. Most of the times, these entities are present in multiples, making them as multiple endemicity countries. And skin NTDs are known for their chronicity, which in a way also leads to disability and associated with stigma and mental health issues. These all require an integrated approach to management, irrespective of their different etiologies. For example, integration of 2 or more skin entities in any country, in a given country, will facilitate a cost-effective solution for all the disease-related interventions, including mapping, disease management, disability prevention and control, through resource sharing, which is very important, more so in resource-limited settings. Another point is the skin entities are visible. We heard it from previous panelists, like one of the very important features is they are visible. And this in particular are entity-related disabilities, which have long been linked with mental health issues. And this is where actually the DMDI is working very closely with WHO and all other things in this framework. We have a guideline on NTDs and mental health that already exists.
Good.
All we need is like raising awareness on mental health needs of the people affected and integrating effective mental health interventions. That really makes a lot of difference to people by giving and improving the quality of life for people, their families and communities. But this all said, there are certain challenges because whenever we are integrating the entities, there is one thing that we have to always look at, that most of these entities, while share commonalities, each of them has their own specific unique attributes that needs to be. So these are some things that need to be always kept in mind when making some frameworks of integration. And in most of the places, these entities, most of them have been programmed as vertical programs. So it is very important that this framework of vertical programs is not totally disturbed or dismantled, because the core skills are always important.
And of course, you know,
Yes.
providing an integrated comprehensive care for, you know, the capacity for that is crucial. I'm going to have to stop you there, Aparna, because I'd like to bring David Denning in at this point to speak about deep mycosis, which poses diagnostic and treatment challenges in resource poor countries as well. At the primary healthcare level, diagnosis may be impossible, a point both Isra and Ahmed Fahal called attention to earlier. How can Gavi build capacity to implement diagnostics to manage these deep fungal diseases?
So Gavi is focused on advocacy for improved access to diagnosis and treatment across the world. In the context of skin fungal NTDs, the key tests are direct microscopy, histopathology, and fungal culture, and then identification of any fungus that's grown. We think that we can upskill many centers across the world in direct microscopy, and fungal culture is one of the WHO essential diagnostics. And both of these assays should be available to everybody, although they are laboratory-based and there's a reasonably high skill set required. So training is a critical feature of this, and we will support that.
Okay.
Histopathology takes longer to train, but there are people in most countries in the world able to do that, and they need to spread their skill set so that that can happen. If there are 100,000 people in the world with a fungal skin NTD, and it costs $25 per patient to make a diagnosis, the global cost would be about 10 million.
So the itraconazole is an important antifungal medicine, but of course access is difficult. What can be done to address this problem?
Itraconazole is a long-standing generic antifungal. The typical dose is 200 milligrams twice daily. It does have significant drug interactions, and so prescribing needs to be done carefully. It generally costs about $4 a day. Clearly, that's beyond the means of many, many patients in low-income settings, but not in many middle-income settings. If treatment is given for 6 months, which is usually sufficient for chromoblastomycosis and sporotrichosis, then and 75,000 people were treated globally, that would cost about 54 million. Gavi would like to see that itraconazole is included as part of universal healthcare in many low and middle income countries, so that individual patients don't have to pay for this. We feel that this is an unnecessary burden on the poor. And at that level of cost of about $50 million, that's something which we would hope that the global community could rise to support for these very specific indications for itraconazole.
Thank you very much, David. I'm going to take one or two questions here. Jeff, if you could respond to this one. Now that WHO has an integrated skin entity framework, which includes leprosy, do you think that the leprosy program at WHO should be and will be fully integrated into the skin entity program and framework?
That is an internal WHO decision, and I have no comment to make on that decision at all. I would say, however, that from my observation, the WHO Global Leprosy Program, although based in Delhi, works in a good collaborative way with the WHO Skin Entities Program, Entities Program in Geneva, and that's as it should be.
Okay, thank you. Alphonse, a question for you. How do you manage integration into health systems in countries where the health systems are mistrusted or dysfunctional? Alphonse? You look ready to answer there, Inigo. Okay, a point from you, Inigo, and a point from you, Alphonse. Go ahead.
Okay, as I said about the integration, as I said, we have focused mainly our activities on the training the capacity building, as I said, then the training also, but also the support of the national control program also with WHO by planning and so on, but also by giving some tools like by integrating indicators of these diseases. That is when I'm talking about their diseases, it's mean yours, Buruli ulcer, leishmaniasis, and into the DHIS2 platform. It was very, very important to do that.
Okay, Inigo, did you want to make
well, actually, I was going to say exactly the same. So many times about capacity building. It's again something that should be repeated as many times as is necessary. You know, capacity building from all the different levels of the chain. It's basic, and also the monitoring for these two. It's basic.
Okay, well, thank you to our esteemed speakers and attendees for your participation and continued and invaluable support. Unfortunately, that's all the questions we can field for now, but of course, like as I mentioned earlier, the rapporteurs have taken note of all your comments, and they will certainly help in defining subsequent themes for consideration or webinars into the future. Joining us now to share his concluding remarks is the Ad Interim Director for NTDs at WHO, Dr. Gautam Biswas. I felt that the level of expert contributions so generously shared is noteworthy. We really needed to have more time, Gautam.
Thank you, Patricia. I would start with firstly thanking all our panelists for the very rich discussions and the experience that they shared. And Patricia, as you have been part of this roadmap journey with us since the launch last year in January, I think what we are talking is in the context of the roadmap. This new framework is a companion document to the roadmap. And as you know, the new roadmap for 21 to 2030 was launched last year after the World Health Assembly had endorsed in 2020. And the spirit of the roadmap essentially lies in 3 shifts and 3 pillars. And one of them is the integration and mainstreaming into the health system. And this is where the integration of the skin NTD came up. And if those of you who have read the roadmap would find there's a lot of emphasis on this integration. And in fact, so that this is what gets measured, gets done, one of the indicators of the cross-cutting indicators is on measuring how countries are adopting this framework within their national health plans and policies. Now, many thanks to our colleagues, experts, and partners who have put together this skin NTD framework. I believe this would be very helpful for countries and even partners to develop their integrated packages. The question then is, how do we make integration work? And during this discussion, we heard the opportunities, the benefits, the challenges. But I think we'll have to make up our mind how this is going to actually work in the countries. And I think let us focus on the health needs of the individuals rather than on the disease per se. This is what we also heard during the various discussions today. And the strong links with the primary health care, because the primary health care is the first contact of most NTD patients, and including the people who have dermatological manifestations. In fact, some of the experts very rightly mentioned that we should go even beyond NTD skin integration within the skin care in the health systems. This is where the patient has his first contact with the health system at the primary healthcare level. And so we need to attack or approach that system, which also needs to be strengthened with capacity building. And there needs to be access to basic diagnosis and treatment and surveillance, mapping of skin disease, etc. I will not go into those details. But it was also encouraging to hear that some of the countries with support of partners have already embarked on this integration process, and it was good to hear their experiences, their challenges, the benefits, and I think this would encourage other countries to join in this endeavor to have the skin NTDs approached in a more integrated way. There are more, I think the benefits outweigh the challenges that we heard. So we encourage countries and partners to share their experience with WHO so that we keep on improving from the experiences, we can keep on improving this framework, develop new tools that would help in the implementation of this framework. And in the end, I would like to thank all of you. I believe there had been over 550 people who had joined us during the webinar. A big thank you to all to take the time and join us. We would look forward to your feedback and comments. And lastly, I would like to thank you, Patricia, for the excellent moderation, and to my colleagues who had made this webinar possible. Thank you. Back to you.
Thank you very much, Gautam, and thank you all again, once again. A quick message here from the writing group of the framework, the Skin NTDs framework, who actually found it very challenging. It was a long journey of more than 2 years. And to also just mention the document is supported by input from many individuals, from experts, the frontline health workers, and online surveys through which they received more than 300 replies. And of course, they want to thank all of you who have contributed to making this document a reality. So just a brief message there from the writing group of the Skin NTDs framework. Thank you all once again for your commitment in standing stronger for NTDs and for making the launch of the Skin NTD strategic framework a success. We've kind of raced through the end there, but I thank you all for your patience and your contributions. Stay safe and stay well. Bye-bye.